I'm super excited to introduce today's panelists. We're going to be going into a deep dive discussion as part of YMCA's Youth Led Solutions Mental Health and Wellbeing Summit on the importance of connection in isolation. The World Health Organization has reported a growing number of people who are realizing the importance of mental health and well-being and promoting positive mental well-being practices on a regular basis. Struggles surrounding mental health affects youth all across the world. 50% of mental health problems are established by the age of 14 and 75% by age 24. COVID-19 has sharpened this focus even further. It has highlighted the importance of community, connection, and self-expression when it comes to mental health and well-being. How do we continue to create a safe community that provides a better understanding of mental health and well-being around the world? That's the subject of today's panel, and it's my pleasure to be moderating it. So let's meet our guests. Please show them your appreciation in the chat and using hashtag YMCA Youth Led Solutions on your socials. First, someone I mentioned a few moments ago, Martin Johnson from Australia. After his own personal battle with his mental health, Martin decided to create the Inside Our Minds program to help other young people with identifying their thoughts and feelings to help others. Next, we have Bonga Chiliza, an associate professor and head of the Department of Psychiatry at the University of KwaZulu-Natal. He is also the president of the South African Society of Psychiatrists, as well as the deputy editor of the South African Journal of Psychiatry. Next, we have Dr. Chiara Servilli, a child neuropsychiatrist and focal point for child and adolescent mental and brain health in the Department of Mental Health and Substance Use at the World Health Organization headquarters in Geneva, Switzerland. Next up, we have Brenda Soriano Villa, Community Development at YMCA Long Beach in the USA, and is currently pursuing a master's in public policy. Her lived experience as a first-generation Chicanx have shaped and informed the way she engages her community and talks about mental health. And finally, Andrea Fuentes. Andrea, a volunteer with YMCA, a Chilean who has been living in Honduras for 20 years. She graduated as a developer in social intervention and a bachelor's degree in psychology. She is currently completing a master's degree in social psychopedagogy and labor psychology. And thank you to Mary Chris from World YMCA for supporting with translation. So what a panel, let's get started. So let's start off with sense making and talking about the opportunity to influence. This question is up for anyone who would like to start it off. Where do you feel the greatest sense of community, and where can you truly understand your mental well-being and express yourself? Maybe we can start off with Andrea if you want to start. I'm not too sure if can you hear me, Andrea? Oh, I guess it's up for grabs. Whoever wants to start us off.
Yes. I have difficulties for English. Wait.
Sure. We can start off with Martin if you want to start.
Sorry, are you able to repeat the question?
Sure. Where do you feel the greatest sense of community, and where you can truly understand your mental well-being and express yourself?
Where I can express myself best, probably all around my friends. That's the best way that I can express myself. That's the most honest and open answer that I can give. Truly fit, when I started my mental health journey, it all started with being able to identify my thoughts and feelings by bouncing those ideas off other people. And then once I had that understanding that other people felt in a similar way, that's when I, had more of an understanding of how I can actually manage my mental health issues, as opposed to, when you don't understand what you're actually going through, it's obviously going to be harder to manage those sorts of things. But once you realize that, other people feel, in a similar way, it makes it much easier.
Definitely. I think there's a lot of comfort in knowing that you're not alone. And even though these conversations are difficult, it does not mean that they should not be touched. So thank you, Martin, for starting us off there.
No
Um,
worries.
Thank you. I would like to direct this next question, maybe to you, Bonga. How do you think we are progressing globally with respect to understanding our community's needs and therefore bettering their mental well-being?
Sure, that's it's a difficult question. I think there's no doubt that we are, compared to 20 years ago, we are doing much better in terms of having these conversations like we're having now about mental health. I think we're still a long way away to truly having, in-depth conversations that for people to kind of understand how important mental health is. I think what I really liked and enjoyed about what I heard today a little bit earlier was that when you talk about physical health, for example, we're also talking about mental health, and there's no doubt that if you're exercising regularly, moderately, and you are going out with friends and you are physically active, it is a much better for your mental health as well. So having those kinds of conversations, I think, are really important.
Awesome. Thank you so much. I'd like to direct this next question to you, Brenda. What do you believe is the key to our relationship, personal and professional, that enables meaningful connection and betterment of our individual mental well-being?
I think part of communication is listening and actively listening. So when we listen, it's not to respond, but to understand. And that goes both in the personal sense when we're communicating with family and friends, but also in the professional sense. I think to also add to the first question you asked about sense of community is I truly feel as if I am establishing a strong connection when someone responds to something, a comment I said, and saying, "Is this what you meant?" or paraphrasing. In that sense, I really do know that they are listening to understand, and that just builds that trust little by little to be able to create that connection, to feel comfortable about talking about mental health or really anything that comes up.
That's a great point. I think a lot of the times we forget that communication is built off of listening and talking. And also not just listening to listen, but listening to understand instead of listening to respond. Thank you, Brenda, for sharing that with us. Maybe I can direct this next question to you, Dr. Kiera Servilli. Um, how do you think we can best balance the need for clinical intervention through experts with respect to languishing mental well-being while being proactive and attempting to prevent this from occurring?
Thank you very much for the opportunity to contribute to this very interesting exchange. I like, the framing, that you are asking this question in this specific panel, in the context of, this summit today, because I think, when, we talk about mental health, I like to see it as, a continuum in dimensions. It's about well-being, it's about promotion of mental health, it's about prevention of mental health conditions and symptoms of emotional distress, as well as it's about providing care and psychosocial support, starting from the closest we can to people, because as Martin was saying, the easiest for us, where we feel like expressing ourselves, including the concerns we may have in relation to our mental health, is friends, and it can be the family, the people really close to us. So as we think about the role of services into this mix, I think we need to situate the services as one element of a much broader whole of system type of approach, where we want to change the environment where young people live, to make the space and the different spaces across the digital space, the schools, as well as the communities, really more like enabling more caring spaces where there is truly an opportunity to be heard. And in that, context of these actions, we situate the services as services that are co-created, with deep understanding of how services can fit the needs of youth, and and there, provide answers that are really, truly, meeting the needs and experiences of young people.
Yes, thank you so much for sharing that important aspect with us. I would like to direct this question to you, Andrea. Um, how do we ensure the individual mental well-being, specifically for young people, given our current climate, is promoted and supported in a respectful way?
Andrea, ¿me escuchas? Sí, te pregunta, ¿cómo aseguras que la individualidad de las personas, en este caso a través de todo lo que estamos viviendo, pueda ser respetada, ¿no? ¿Cómo se puede respetar la salud mental de los individuos a través de todo esto que estamos viviendo?
Muy buenos días, gracias por la oportunidad. Tengo algunas dificultades para entender el inglés. Bueno, con respecto a... Es una pregunta complicada, porque profesionales de la salud mental y estamos conscientes de cómo debemos de respetar a cada individuo. Sin embargo, el papel es duro. La situación es ardua, sobre todo en Latinoamérica, donde hay que desmitificar el tema de salud mental. Es un tabú.
Yeah, so she says sorry because of the difficulties with the language, but and the question that you ask is also a very important and hard question. She says that even in her experience of being a mental health professional, it is hard. It is hard for everybody to really acknowledge how we should treat, how we should care for each of individual going through a difficult time. Even here in Latin America, actually, where mental health is still considered to be a taboo, something that we really don't talk about. So, yeah, it is a process and a different situation with each person.
I think that the topic and touching on the fact that it's a taboo issue still is super important. I think a lot of the times we want change to happen overnight, and sometimes we know that's not possible, but it's really important to take that first step, which is awesome. Thank you so much for touching on that. Now that we've kind of gone through our first round of questions, I do want to have this open dialogue, so feel free to just hop on when you kind of resonate with a question or you'd like to share a story or answer it for the audience. So the first one I have here is, how do we amplify the voices of young people to ensure they are being heard and encouraged to express themselves with respect to their mental well-being?
I can go first for that one if you'd like.
Awesome.
All right. So I think that talking about expression, obviously expression is something that comes in completely different forms. It's something that, it's about how your thoughts and feelings are being presented to, the outward audience. So I think I'm trying to talk as slowly as I can, being Australian, by the way, sorry about that. The quote about, build it and they will come. So I think a really good way to think about this is that with young people, it's create them a space and then give them the agency to be empowered, and they'll show you what they can do. And I mean, look where we are right now, and look at the audience of people that we have that are connecting into this, and then seeing what we're doing with mental health on World Mental Health Day. I think that's proof of what I'm talking about there. So one of the great things that the YMCA did was obviously the Change Agent program, and the Change Agent program really, for me, provided that agency in terms of allowed that two-way conversation. It stopped being that that question that I was always asked about, what do you want to do with your life and what do you want to be, and then it became more of a, or how can I help you get there and what can we do to support you. So with that program that the YMCA did, I was able to create the Inside Our Minds program, and now I'm able to promote those voices and continue to support those people. Although I don't see myself as a young person anymore, I'm still out there making sure that those young people's voices are heard, making sure they feel really supported, making sure that they can express their feelings, their thoughts, their opinions, and then hopefully be able to help other people with their mental health, because that's really what it's all about. Like, we're all individuals, and we're all trying to do the best that we can, and we should stop thinking of ourselves in individual boats and start thinking of us all in the same boat and rowing in the same direction. So I think that as long as we continue to support each other, and look out for each other and provide young people the spaces to create, and yeah, see what they can do after that, because that's really where the strength of young people come from.
You touched on so many amazing points there. Something that really stood out to me was talking about how youth want to talk. They want to have this conversation. They want to create this change, and they have the motivation and power to do it, but sometimes they don't know where to start. So when you provide a space for a young person, it's amazing to see what they can do and what they will do with it. Thank you for starting us off there. So does anyone else want to touch on how we can ensure that youth express themselves in respect to their mental well-being?
Yes, if I may, I would like to add to what has been said already, just, to provide the perspective of us, from the WHO perspective, I'm really, so pleased, to see that, especially during the COVID pandemic, young people have been given better opportunities to really co-create solutions and for their voices to be heard in a different manner, I think, for the first time, in respect to their well-being and mental health. However, I think, when we look at the opportunity to share experiences of locally driven projects and services and experiences, there is a lack of data in terms of evaluations of those co-created services and interventions and projects. And that is a challenge for us, because we want to make sure that we are able to provide evidence-informed type of lessons learned and share experiences that have been evaluated in the field. So I would like, to empower young people even further, for them to be able to evaluate the experiences they're part of in local communities, to be able to share them broadly, so by establishing global community of practices, as well as, having an opportunity really, to I would say, yes, to have, and also, to scale up those locally driven solutions. So I think, there is a correlation of, an emerging, there are a number of projects locally driven with engagement of young people, and probably, meaningful engagement and co-creation, with young people, but less opportunities to scale up and to evaluate those projects.
Thank you for sharing that. I think it's super important to acknowledge that if we want something that we've never had before, which is whether it's better services for mental health or destigmatizing mental health, we have to do something that we've never done before. So whether it's a new program or speaking up more, I think it's important to highlight that. So thank you so much for sharing that point. I will pass it on to Andrea.
Bueno, comentaré más o menos qué es lo que estamos haciendo acá en Latinoamérica.
Yeah, so Andrea is going to share a little bit about what they are doing in Latin America.
Actualmente soy parte de la red de salud mental de Latinoamérica y el Caribe.
So she's now part of the network for mental health in Latin America and the Caribbean, YMCAs.
Y estamos adaptando un documento que nació en Inglaterra, Talking.
So they are adapting now a document that was born actually in England, which is called Talking.
estamos partiendo desde cero, desde la elaboración de los instrumentos y las entrevistas, segmentos.
So we are actually starting from zero, adapting interviews, adapting the format of the document, trying to gather information.
Además de hacer estas preguntas a los equipos principales de la YMCA, como son secretarios generales y profesionales.
And we are also working together with all the different teams in the YMCA. So, for example, asking these questions to general secretaries, staff, and others.
También nos estamos enfocando principalmente en los jóvenes voluntarios y beneficiarios de la YMCA.
But especially we are focusing on the young people and the volunteers and the beneficiaries from the programs of the YMCA.
Entonces, una de las preguntas principales que se hacen es saber las necesidades, temas que a ellos les interesan en cuanto a la salud mental.
But one of the main questions that we ask and that we try to keep in mind is know what the needs are of the young people regarding mental health.
Entonces, hay unas grandes necesidades en a saber y conocer mucho más temática y ver cómo ellos también pueden hablar cuando con sus pares.
So there's a lot of needs regarding knowing and understanding what mental health is and how young people can actually speak about it with their peers.
Entonces, desde ese enfoque nos hemos para trabajar en los intereses principales de la juventud.
So with having that in mind, we have worked very hard on having the needs and what the young people really want to know about this topic. And that has to be the center of the work that we are doing.
Ahora nos encontramos en la etapa del análisis de información y también tendremos actividad para conmemorar, ¿verdad?, lo que es el Día de la Salud Mental, invitando a varios segmentos de la población.
So right now we are in the stage of making the analysis of all the information that we have gathered from the region, and we will also be hosting different activities regarding mental health.
Awesome.
Thank
Y
you.
una vez que ya vayamos este proceso, lo invitaremos a...
And once we finish with all this process, we will invite you all to join us, and so that you can find out more about the work that we are doing here in Latin America.
That's so awesome. Thank you, Andrea, for sharing that with us. Something that really stood out to me was that we need to incorporate youth when we're talking about youth mental health. We need to be asking them what it is that they need instead of making assumptions on what youth need. How we live our lives today is very different from how people used to live their lives back then. And it's super important that we do incorporate youth voices and youth input in the changes that we're trying to implement today. So thank you so much, Andrea, for that reflection, and Kira and Martin as well. I also want to remind the audience that we do have an opportunity for you to send in questions. There's a Q&A feature here on Hopin, so hopefully that is easy for you to locate, and you can send us a question for the panelists. Another question that I'd like to ask is...
Sorry, Luisa, can I add one thing? Sorry.
No worries, go ahead.
I wanted to just say that I think what's also important is that we need to be a lot more flexible when working with young people, and be, and not be afraid to kind of box everything in and say this is how you must input, or this is how you must do certain things when we are. And so, for example, if people are better at video, at different platforms, writing things, storytelling, acting things out, etc. We should really allow them those multiple sort of ways of speaking about mental health. And it even though it's uncomfortable because we're not used to it's new spaces for us, and it's new different ways of doing things, I think it's actually much richer at the end. You get a lot more information out. So I just wanted to say that I think the YMCA has been, but I think we could definitely be a lot more flexible in the way that we try and engage with young people on different platforms, and that's how we'll be able to hear their voices. Thank you.
That's an amazing reflection as well. I think it's really important to know the diversity and what helps youth and what ways we can reach youth and the different mediums that we can use, whether it's sports or painting or videos, like you had mentioned. I think it's definitely something that we could work towards together as an entire organization. I don't know if you want to kind of add on, Brenda, just about how we can express or how we can ensure that youth are expressing themselves in respect to their mental well-being.
Sure, thank you. I think one thing to think about or to center the conversation in is intersectionality and ensuring that youth, when they come into a space, are able to show that part of themselves, whatever that is, whatever they want to bring at the forefront of themselves, but that everything is valued. I think that is done through within our spaces, whether it's a Y, whether it's at home, through just being vocal. And vocal in the sense of using our voice, but that also means being there physically, knowing or asking when it could be when they need support. And it's that intersectionality that can really be celebrated by just knowing and what's happening around them and asking those questions. So as we talk about mental health, ensuring there's also that space to talk about what makes us us, and what makes me, and finding connection in that sense as well.
I think the most, I guess, standing out point that you had brought up was the power of conversation. For me, like I've said for many years, and at YMCA 175, I think conversation is the most powerful tool we all have access to. And I think it's amazing that you highlighted that, and that conversation can go a long way in creating community and making a safe space for young people to talk about mental health. So thank you for sharing that reflection. I'm going to now pass it on to the audience questions. So again, feel free for anyone to answer this. We can start off with Ao Andrew asks, what is the best approach for mental health campaigns for education in rural communities, especially where everybody is at risk in this COVID-19 pandemic?
Bueno, aprovechando la tecnología, estamos en un momento en que la misma pandemia ha permitido que haya un poco más de acceso a estos medios.
Well, making use of the technology, the pandemic has actually shown us that we can have more access and reach to people through these electronic ways.
Yes,
Por lo
definitely
tanto,
utilize.
a pesar de las limitaciones, se están dando a la mayor cantidad de jóvenes.
So regardless of the limitations, we are trying to impact as many people as we can in these different ways.
En Latinoamérica es de a poco.
Here in Latin America, we go step by step. Thank you.
That's awesome. I think, talking about how we can utilize technology to enhance our connection and to keep each other, to keep checking on each other and checking on each other's mental health is super important. And I like that, taking it step by step. I think that's something we all need to do. Take a step back sometimes and just think about, let's take this one day at a time. Thank you for that, Andrea. I don't know if anyone else wants to touch on that. What is the best approach for mental health campaigns or education in rural communities, especially where people are at risk in this COVID-19 pandemic?
I can speak to that one a little bit. So Just to give you a little bit of context, here in Australia or here in Western Australia, I can fly for 6 hours and still be in Western Australia. So being in a rural community is incredibly far out, and using technologies sometimes would not be achievable in some of the remote areas that we would have to be able to go. So just to provide a response to the person who asked the question, firstly, it was a great question. Secondly, I don't think I think the best approach is that you have to use multiple approaches to be able to source that solution. Touching on a little bit of what Bonga was saying before, where you've got to make sure that there is multiple avenues for a person to express themselves, and knowing that a person can express themselves in multiple ways. Looking at mental health, I believe we should be looking at mental health the same way that we look at physical health, where physical health, we don't treat physical health always in the same way. When we look at someone who, has a broken leg, we don't just provide them with crutches. Sometimes we provide them with a wheelchair. When we look at mental health, we should be looking at multiple different avenues, whether it be supporting them with a person, potentially with medication, with therapy, and a variety of different options. So I think that the answer to the best solution is multiple solutions, and making sure that those solutions are accessible to as many young people and to as many people in those communities, so we can provide the best care that we can.
I think that's super important, taking that multifaceted approach to helping youth who are struggling with their mental health, or anyone struggling with their mental health, really. Yep, go ahead, Dr. Karas.
Yeah, just briefly, but I really want to emphasize this important message about, making sure that we engage the different perspectives of young people with particular attention to those groups that may be that may be more difficult to reach, and also, particularly those that may be facing adversities, or maybe at more risk of experiencing distress and emotional distress, or other risk factors of different kinds. And this is important. I think we have been discussing youth engagement. How are we really making an effort to engage those that are living in contexts where access to digital technology, or where they're living in particularly difficult situations? I think this is also I'm thinking about the motto of the SDGs, leave no one behind. I just want to bring it up here to make sure that we do engage in a very inclusive way as much as possible. Languages is an issue, but there are so many other issues that we need to take into consideration to make our approach really an inclusive one. Thanks.
Yes, go ahead, Bonga. Yep, go ahead.
Yeah, I think that I agree with what's just been said, but I also think another just a practical sort of point is that if you are trying to do this in the rural areas where there's limited resources, perhaps piggybacking what you're doing on what other things are already happening, I think is very useful. So for example, in our country, there's a lot of programs for HIV prevention, for example. And so trying to add on a sort of mental health information campaign on that is already happening in the rural areas, I think is often useful, because the infrastructure is already there and there's already people that are delivering these kinds of interventions. And we're just trying to add on a little bit about mental health. Thank you.
That's perfect. Thank you so much for sharing that. We're almost at time, but I want to kind of get one more rapid fire question out there. A lot of people have been asking, when there isn't access to professional help or services, how do you each practice self-care and look after your mental health? So if each panelist could quickly share a way that they practice personal and self-care, that would be awesome. Maybe you can start with Martin.
Mic down, mic up. All right, there we go. Got it. So my personal way that I manage my mental health or look after myself with self-care is that knowing when things are getting too stressful for me, and then making sure that I provide myself the space to decompress. So with the Inside Our Minds campaign continuing out through Mental Health Week, it's usually a pretty stressful time for me. So I like to make sure that afterwards I plan ahead, and I know that that's going to be a stressful period. Same with when you're studying, or same with when you know that you've got an important project due at work, or any of those sorts of things. Make sure you, if you can, forecast knowing that you might be mentally exhausted, forecast knowing when you can provide yourself that downtime, and then make sure that you understand yourself and then what you kind of need. So after this week, I'll be definitely taking a little bit of R&R, having a couple of days off to myself, unwinding and then relaxing in the way that I see fit, obviously always in healthy ways. But that's myself. Thank you so much.
I love that. Thank you so much. Bonga, let's hear from you. How do you practice personal care and self-care?
Yeah, I think for me, it's about kind of giving yourself permission to have personal care, and then for me again, it's about physical health stuff. It's about going for a run, going for a walk, being outdoors at times, and I would say to young people that please do avoid certain things that they may seem at the time that they're good for you, but they actually may take you a couple of days to recover from those things, which are then, obviously then impacts on your functioning. So binge drinking and those types of things are definitely not good for your mental health. Thank you.
I think allowing yourself and giving yourself permission to take a break, I think that's super important. So thank you for sharing that. Brenda, go ahead.
For me, it depends. I always gauge how much time I have to be able to, give myself that self-care time. But often I find myself going on walks, and my phone's always with me, so I utilize it in the sense of my camera. So whenever I see a flower or a tree or something interesting, I take a picture because it brings me back to that moment of I'm walking peacefully, I'm reflecting on just the day or the week or that moment that brought me to come to this walk of practicing self-care.
Awesome. Thank you so much, Brenda, for sharing. Andrea, let's hear from you. How do you practice self-care?
Después de la pandemia nos damos. Comer mucho más saludable. También practicar yoga en casa.
So after the pandemic, we reinvent ourselves by eating healthy because we needed to stay healthy in our bodies. Also practicing yoga at home.
Y meter cuanto curso de manualidades lo hago.
And just joining every workshop of handcrafts because I love doing that handcraft and creativity work.
Awesome. Thank you so much for sharing. And lastly, Kara, would you like to go last? Dr. Kira Servilli, did you want to go last and share how you practice self-care?
Yes, I think I also make sure that I keep up the healthy habits, particularly with going out in the woods nearby Geneva and enjoying some time, hiking on the mountains. Luckily, during the pandemic, there was WHO colleagues actually made available a stress management guide, what matters at the time of a time of stress, which is currently available as a chatbot also. So I found that also, that one particularly useful, at times, especially when the pandemic hit, the region in Italy where I come from. So that was a useful resource to have at hand.
Awesome. Thank you so much for sharing that. And thank you everyone for sharing your insight on how you practice personal and self-care. A big thank you to all of you, Martin, Brenda, Kira, Bonga, Andrea, and Maricus, for joining us today for the panel. Thank you so much for sharing your reflections and insight. We all really, really appreciate your time today.